Good morning, everyone, from Drug Free Action Alliance in Columbus, Ohio. My name is Brittany Sandage, and I'm the Director of Coalition Programs here. I will be on the back end monitoring all of your questions as we go through the webinar today. Thank you so much for joining us. And without any further ado, I'll introduce Tony Coder.
Good morning, everybody. Thank you so much for joining us here at the for the Advocacy webinar for the month of October. Temperatures starting to get cool, and we are so glad that you're able to join us this morning. Crisp, cool fall morning. We are going to go straight into the Medical Marijuana Advisory Committee has been named. Curtis, I do not know how to pronounce his last name, and don't even want to attempt it. The first name will be the chairman of the committee. He is the vice president of pharmacy services with Ohio Health. Stephanie Abel is a pharmacist with the Ohio State University. Ted Biebart is an attorney. Myself, Michael Hirsch is he's the agriculture person that's supposed to be on the committee. He's the owner of Hirsch Fruit Farm. Jason Caseman is the labor representative. He is the political director for the United Food and Commercial Workers. They were one of the only groups in favor of Issue 3 last fall. They wanted legal marijuana in the state. John Linhart, who is the Shelby County Sheriff, is the law enforcement representative. Martin McCarthy is a caregiver rep, and he's going to be representing caregivers, obviously. Dr. Jerry Mitchell is an oncologist. Nancy Mosca will represent nurses. Marcy Seidel, our executive director here at Drug Free Action Alliance, will be representing some mental health, the mental health field. Dr. Amol Soin is a pain management physician. Michael Stanek will be representing business, and Gary Wenk will be a physician representing representing physicians who are in favor of medical marijuana. He's a Ohio State University professor. These folks, we don't know exactly when our first meeting will be. It has to be done by the November 8th. I am hopeful that we will get some great suggestions on what some of those concerns are. We know that we've kind of taken a look at the bill and have looked at some of the rules and regulations that need to be answered that are kind of unanswered questions right now. If we want to move to the next slide.
Tony, before we move on, I've had a few questions about tech issues. Could anyone who's having difficulty hearing, whether it's an echo, please send a quick chat and just say tech. That way I can monitor whether this is a larger issue. Thank you, everyone.
Okay, so the next slide we got here, the rules and the regulations that we are really concerned about. The advertising that there will obviously be advertising in our state. We don't know how that looks. There was nothing in the law that goes over that. Very interesting today, a new study in the latest issue of Prevention Science was released today that measured the advertising impacts in Colorado and Washington. There were, according to they looked at Weed Maps, which is an app for the phone where people can get advertisements and the locations for weed pot shops and those types of things. Some of the things that they found were that, first off, many retailers had no security measure to determine a person's age. So about 41% in Colorado and about 35% of the folks in retailers in Washington had no, if you go on an alcohol website, they ask for your birth date to verify an age, which is just the very minimum that is offered right now. a lot of pot shops, 4 out of 10, don't even do that in Colorado, which is allowing, they believe in this study, for young people to be able to interact directly with marijuana retailers, even though it's not legal out there. Secondly, all advertising by marijuana retailers, they feel that imply health claims should include sound scientific evidence supporting those claims. There's many of them that claim that there are health benefits to using marijuana. However, they list a variety of ailments, but they don't list any of the science in the background or on the website or within their advertising. So they really think that that should be another piece that is added into the advertising regulations. And again, interestingly enough, this just came out today, so it can hopefully guide some of the conversations here. Obviously, some of the issues that we will have are advertising to young people. I really don't want billboards, really don't want some of those things. Again, but this is, again, an advisory committee. These do not actually make the rules. They give suggestions to the Board of Pharmacy, the Commerce Department, and the Ohio State Medical Board to what the rules are. They just give advice. And those 3 entities actually make the rules. Will there be delivery services, i.e. pizza, what is that, Domino's Pizza, get you your, or I'm sorry, pizza. Can you have marijuana delivered to your door? This is something that, again, not in the rules, something we need to look at. One of the issues, and I've been asked by both pro and anti marijuana folks, what is a 90-day supply? What does that look like? Both of them are asking. Obviously, pro-pot people want a large number, and those who are against it want a very low number. And since there's not any science that backs up any of this, it's going to have to be kind of a crapshoot. And looking, I guess, what other states do, what other, some kind of medical, if there are any medical journals that kind of list what a dosage of marijuana is. What is the THC limits? We know that the limits are 35% for plant matter, 70% for concentrates, but we don't know what the what works with what. If I have glaucoma and my doctor recommends it, does that mean that I need a 30% THC and 3 times a day or something? It just doesn't make that's something that doesn't make any kind of sense without any kind of scientific backing. Taxes will have to be recommended. What kind of taxes? Again, we have 2 sides of an issue on this. If the taxes are too high, you just strengthen the black market. A lot of underground. That's the problem with Colorado. That's what's the problem with Washington. You have a 25% tax. People are going to go back to their dealers. Dealers are not going to stop making weed. And however, if you do too little of a tax, then you don't cover the social costs. We know that there will be a much higher issue with drug driving. We know that law enforcement is going to be put under the test here. We know that more addiction issues, homelessness. There's been quite a few issues and articles on homelessness that I can share with folks in the Denver area that the social services system is having to deal with right now. So, taxes is another big issue that there just really aren't any good answers to. How many cultivators? Some will argue that we need cultivators, 10 growers. But that goes kind of back to that same thing we were fighting in 2006 and 2015 with Responsible Ohio. Does that create just a marijuana monopoly for individuals? But if you just allow it to be something that is, pretty wide open, where you have a lot of small growers and let the chips fall where they may, do you have an overabundance of marijuana? So it really is, there really are an awful lot of things to think about. Would love to hear your thoughts, would love to hear your feedback on these things. As we're making decisions, I absolutely am going to rely on everyone out there to give me their advice. I'm one person. Marcy's one person. Every one of these folks who are on this committee are one person, and quite frankly, at least 5 of them are pro-marijuana in the state. So it's going to have to be some science-based and research-based types of recommendations that we give. How does that work? And then you get how many patients for each caregiver. The Caregivers Association is already is already a lobbying group. Edibles. So there's really just a variety of questions that we don't know what. We just don't know what's going to happen, but I do need your help. I do need your feedback for us to figure this out. Moving on, so the election is coming up. I will not talk about who is better. Someone actually asked me on a radio show who was better for our issues, Trump or Hillary, and I said I'm writing myself in. That was my answer. I didn't. Who likes who and who says what and does what. After the election, we're going to have what's called the lame duck session. It is not the little duck in the cast there that signifies that. It is basically that we have people who will be leaving state service, representatives and senators leaving that, and we're going to be basically, it's a time where a lot of bills are going to go through at an incredibly quick pace. One of those bills that we understand that they're fighting for is House Bill 248. Has said that he has given the green light to move forward with the abuse deterrent drugs. Basically, it's that crush-proof medication. So if you are if you're a physician who thinks, has suspicion that your patient is a user of prescription drugs, misuses, abuses prescription drugs, you can actually prescribe under this bill this crush-proof medication. They can't crush it. They can't, snort it and or put it into some kind of liquid form. This is something that we hope will get actually into the opiate MBR, which I'll talk about in a little bit, which will, without a doubt, pass this year. There are some issues with that as well, but they're hoping to get that into the opiate MBR. The Senate has been somewhat slow on this House Bill 248 and this crush-proof medication. So Senator Hyde introduced Senate Bill 357 just to get a conversation going. Do we really see Senate Bill 357 going anywhere? Starter. We can't have a conversation in a committee without actually introducing a bill so that people can talk about crush-proof medication. You can have your witnesses come in and talk about the importance of this type of technology with our medications. So this is something that we'll see probably get slipped through to the opiate MBR. Another issue we just have to keep an eye on, House Bill 555, is the alcohol ice cream. Ice cream would be under this bill, manufacturers could create ice cream that has 6% alcohol per, I don't know what it is, scoop or volume in it. We obviously, this is kind of marketed toward kids. Kids like ice cream. Adults like ice cream too, but this is something that we don't want young people to be around. So this is something we'll be fighting. There's also a very interesting bill, House Bill 597, going back to the marijuana issue. It's a marijuana reciprocity bill. Basically, there's a loophole. There's no smoking of marijuana in the state of Ohio. For medical marijuana folks. However, if you are a person from another state, whether it be Colorado, Washington, there's a loophole that says they would be allowed to smoke in Ohio because their recommendation says that you can use smoked marijuana to treat your condition. So this bill would actually wipe that out, and those folks, even from out of state, would have to follow Ohio laws and not allow smoking in the state.
Tony, before we move on, we did have one question that's relevant to marijuana and what you just brought up. It's a question about how long we believe the city moratoriums on pot shops can realistically last. Is it a year? Is it longer? What does that look like?
The longest I'm hearing is a year. Some are going 6 months. The rules will not be written in 6 months. It's going to take a little longer than 6 months, I think, to write these rules. I think they have to, March of 2017, I think, is the goal of these rules to be written. So there's going to be an awful lot of talk. So I think a year is the max you should do that, and then you can go to bans and those types of things. All right, let's go on. Thank you for the question. Spoke a little bit about the opiate MBR. Senate Bill 319. It was introduced this past spring, actually, and there was a lot of fanfare around it. This is what's going to fix the state. And some of the policy pieces in there are that pharmacy tech registration and new certifications will be developed. It would not, your pharmacy techs right now can get by pretty easily actually my son is a pharmacy tech person at Kroger while he's going to school. Not a whole lot of knowledge in that. He's going to school for political science. So some new certifications in pharmacy tech and registrations and those types of things. You got to know a little bit more about the drugs than what you would have right now. It would expand into naloxone distribution in the as far as what could be done. Boards of health could furnish naloxone without a prescription to family members, to friends, those types of things. And I don't know whether that is both the shot and the nasal spray, or just the just the nasal spray. But the boards of health would be able to furnish that. Project Dawn expansions around the state would also take place. So more cities would get involved in that program. Methadone clinics, there would be expansion of methadone clinics around the state. Not so much there would be any kind of funding for methadone clinics. What it would do, it would take away some of the bureaucratic paperwork that you have to go through right now to get a methadone clinic here. That would take away some of that, some of those regulations. Some of the other pieces, no more than a 90-day supply of opioids could be dispensed in the state of Ohio, so you couldn't have a 180-day dosage, those types of things. And then expansion of recovery services through drug court programs, which I think are absolutely needed. We have, these are really, I think, good policy pieces that do need to put in place. The issue lies, again, there's no funding attached to this bill. So as much as as much as we try to do things through law, if there's no funding to actually fund Project Dawn expansions, then how exactly does that work? Does that rely more on local levy dollars? Does that rely on some other funding that's not put in place right now? I think we really have to look at this as something that is, I get that they want to save taxpayer dollars and those types of things, but without funding for expansion of treatment, expansion of prevention services, recovery supports, it really is kind of a lot of talk and no action, which I'll probably get in trouble for saying that. But this is something that I really think that we need to look at and have some suggestions for. This is going to move through very, very quickly, and we need to make sure that prevention not only is actually in this opiate MBR, the expansion of prevention, promising and evidence-based prevention practices, but also perhaps let's get some funding in there for that as well. This is not going to be a problem. It's going to fix itself. It's going to take resources. It's going to take manpower, and it's going to take a lot of time, quite frankly. Okay, so going back to marijuana, I want to talk a little bit about the national marijuana front. We have, so by this time, actually I think it's the next time we have a webinar is the 8th, and that is that Election Day? I think it's Election Day. So we will actually there will be 5 states voting on a recreational ballot bill. Arizona, California, Maine, Massachusetts, and Nevada will have ballot initiatives in their states. Frankly, I see 3 of those going down. I see Arizona getting defeated, Massachusetts, and Maine. I fear that California and Nevada will have recreational marijuana legalized in their state. And being out in California a few weeks ago, the medical marijuana is doing nothing for them. The places I went, Hollywood Boulevard, some of the more touristy areas, the pot smell was almost overwhelming. The medical ballot initiatives, there are a couple of medical marijuana ballot initiatives that are on the ballot for November. Florida has one. This is hotly contested. Florida only won. Florida, our side only won by like 2 points last time, and they're putting the other side is putting an awful lot of money into legalizing it for medical purposes this time. I don't know how that is going to play out. I think it's pretty close right now. Montana is, so they have a medical marijuana program that that was created back in the early 2000s, and then they decided, the legislature in their state decided this was not, the dispensaries were out of control. So what they did is they put another ballot initiative, and it actually reduced the number of dispensaries and actually wiped them out in the state of Montana. So what this is about is making dispensaries legal again in the state of Montana. So it's kind of a back and forth type of thing, and that is on the Montana ballot. Arkansas is interesting. They've got 2 of them. They're competing with each other. So there is, what is it, question 6 and question 7 is what they're looking at in that state. Question 7, quite frankly, is quite scary to me. They actually have language in their medical marijuana bill that once it passes, question 7, if it does pass, then it would be illegal to repeal the law. So there would be no way that you could repeal a medical marijuana law, which, no matter how much research may come later, it would be definitely something that is really quite frightening to me, and something that had never been done in other states. So those are what's going on the national marijuana front. And just a very, very quick word about carfentanil. Nathan Kratz, if you don't know Nathan is Nathan's our new communications manager. And he and I went to a NARCO meeting, which is the National Narcotics Officers meeting. It was their Ohio chapter. They were having a meeting here in Columbus, Ohio. And a DEA representative was there to talk about carfentanil. I didn't know too much. I don't know too much about carfentanil. So just wanted a little bit of education from him. Quite frankly, this is one of the scariest drugs I've ever heard of in my life. It's skin permeable, is what he said, so it actually could be soaked into your skin. It's not something that just has to be snorted or taken in that way. They're actually training, and he talked about the trainings they're going to have with folks who even do some of the undercover work as far as what they have to wear, hazmat suits. You can't get it on your clothes. There was talk about what if you do a bust, and this stuff's a powdery stuff. So if you go through it, it gets on your clothes. Your kid, you go home, your kid jumps on you, says, "Hey, Daddy, I'm glad you're home," or whatever. That child could be subjected to overdose just by the amount, the little dusting that's on your clothes. This is how powerful this stuff is. So they're going to start requiring law enforcement where they believe that carfentanil is being created, that they will have to wear those for any kind of bus and those types of things. I don't know what the narcs are going to do, or any of those folks who actually have to go out and make the buys. That is a hand-to-hand type of exchange there. money for drugs, and if there's any of that, that was a question that was asked, and not a whole lot of, not a whole. One of the officers said, "Well, could you say that you have MRSA or something, and you have to wear gloves?" So there really is, quite a dangerous drug. Quite a dangerous drug. 20 micrograms is what it takes to kill a person, which is smaller than a grain of salt. It's about $2,200 per kilo, which is a really, really cheap drug. And a kilo, this DEA guy said, it could potentially kill 50 million people with 1 kilo. It's made in China. It's not regulated there. And it's also being made here. It is found in some heroin. It's relatively easy to make. I guess it just takes a couple hours to make this stuff, and which is that's what they were fearful, that this is actually going to wipe out the heroin market. As scary as that sounds, because heroin is actually poppy plants, and you got to grow them, and it takes a while for those things to grow and to actually come to fruition. Whereas this is just made in a lab somewhere. It's another analog that we're just frightened about. There was a stat in Akron, Ohio, over a 3-day period. There were 25 doses of carfentanil, with 4 of them being fatal. I'm actually going, Brittany doesn't know this, so she may look at me and give me the stink eye, but I would really like this DEA rep to come to Ohio and talk to us about carfentanil, because it really is a dangerous, dangerous drug. It's 10,000 times more potent than morphine, 100 times more potent than fentanyl. So, as you're talking with your law enforcement folks, this is something you might want to bring up, that's more and more of this is on your streets, that this is not something to check the DEA website, which I'm sure they do, but another good way that we can, provide our expertise to someone not necessarily in prevention, but our partners out there who are doing the toughest jobs in the nation. Didn't know if there were any questions or anything.
Yes, Tony, we have had 1 or 2 questions come in the last few minutes. More comments, actually, just speaking to some of the expansion on the opiate MBR bill. It was brought, of course, to our attention that a lot of the naloxone is available over the counter at this point. Do we have any idea of what the logic is behind why they're expanding in this way? What is it seeking to achieve?
Frankly, from what I'm hearing, is that not only are we does naloxone need to be expanded because you're getting folks taking multiple doses. There was this carfentanil as well. In fact, the DEA guy said naloxone, you're going to have to use a lot more dosage. And naltrexone is what he is suggesting that people should be using for carfentanil overdoses. There's just a lot more overdoses going on in the state, and sometimes you have to hit these people, a couple times. One person that in the narco meeting said he had to give 22 doses of carfentanil. I'm sorry, carfentanil. 22 doses of naloxone to keep this person alive, to get him to the hospital or whatever. So it just is, the number of people are dying. I don't think everything we're hearing and seeing is that our numbers of opiate overdoses are going to go up again by quite a substantial number in 2016. And because of that, and trying to save so many people, it's just folks are running out, and it's much more needed than it ever has been before.
Thank you, Tony. A couple of participants are also asking where they can access these slides, particularly the carfentanil slide. Just as a note to everyone, when the email goes out today that contains your certificates for participation, there is a link to the YouTube video where you can you can also listen to this again. But in addition, we do make all these slides available in our member center. Just email Tony or myself, and we'll make sure you get a copy of that. And additionally, we had a comment from Nicole down in the Cincinnati area indicating that their Chief Tom Synan in Hamilton County was reporting that there were 174 overdoses within a week related to carfentanil down there. Just as a general note to folks, I think we're certainly concerned about figuring out where some of these areas are, which coalitions are hearing about this as a rising concern. So please continue to share that with us. At this time, I don't have a lot of new questions. I'll give you guys another second to send in any. But in response to that, Tony, yes, the next advocacy webinar is on November 8th. So we hope you can all join us then. Any parting thoughts, Tony?
No, we'll also post, I will shoot Brittany a video that the DEA sent out about fentanyl and carfentanil. It was a warning video that is quite troubling as far as what is going on out there. It's a good education piece. It's for law enforcement, so it's not something that we would normally see, but it really does kind of give us some insight into how dangerous these drugs are, and as we're going out with our community members, it's a good reference that we can have when you get questions about this. So I will send that to Brittany. That will be part of our send out that she does this afternoon or whatever. Okay, well, I don't see any other questions. I thank you so much for being part of this webinar. Of course, if you have any questions or anything, please contact me. Again, I really, really need your feedback on some of those issues that we're going to figure out for marijuana. Really need anything that you have. And then also any suggestions, anything on the opiate MBR bill as well. As we're going to, we've got to have a strategy session about that sometime. So I thank you so much for joining us, and look forward. So glad that you're our partners out there. You're doing the upfront work. You're doing the hard work out there, and anything we can do to help you out, we're more than happy to do. Thanks so much.